Thank you for joining us for another topic in our heart failure series. Today's topic is heart failure tests, treatments, and devices. Just a quick review about what is heart failure. Heart failure means the heart is not able to pump sufficient blood to meet the demands of the body. It doesn't mean that the heart has stopped working or beyond repair. Many treatments are available to help patients live longer and feel better. Heart failure can be treated, but not cured. Heart failure tests. When your healthcare provider suspects that you may have heart failure, a number of tests may be arranged. Tests like blood work. They'll look at your blood counts, your kidney, your liver, and your thyroid function. They also might measure your BNP, or a brain natriuretic peptide, and this is a naturally occurring hormone which is elevated in the presence of heart failure. An ECG. This may provide clues that a chamber in the heart is enlarged or can sometimes show evidence of a previous heart attack. A chest x-ray. This can give information about the size of the heart. It also looks at the lungs and can show if there's extra fluid build up in the lungs, which may cause shortness of breath. An echocardiogram, or echo. This is an ultrasound of the heart. It provides detailed information about the heart's structure and function. A coronary angiogram. This involves placing a tube, called a catheter, either in the wrist or the groin, and passing it up to the heart. This test allows a very detailed look at the arteries around the heart and any narrowings or blockages that may be contributing to heart failure. Additional heart failure tests might include a MUGA scan, a nuclear stress test, a cardiopulmonary test, a cardiac MRI, or a cardiac PET scan. Heart failure treatments. A healthy lifestyle is an essential part of managing heart failure. Because your heart is not functioning normally, your body is not able to deal with the extra amounts of sodium and fluid. That means it's important to manage your heart failure risk factors, things like obesity, excessive alcohol intake, diabetes, and high blood pressure. Pay attention to your diet, particularly the amount of fluid you drink, and as well as the amount of salt or sodium you consume. Monitor your weight daily. Use the weight log on our website. Participate in regular exercise, including strength training. Manage low stress levels. Practice relaxation exercises, as well as some deep breathing. And take your medications as prescribed. Don't stop taking your medications. If you feel you're having side effects, talk to your healthcare provider. All of these steps have been shown to improve how you feel, can make you live longer, and prevent the need to be admitted to hospital. Heart failure device therapies refer to specialized pacemakers that may either make your heart pump more efficiently or may protect you from life-threatening arrhythmias or abnormal heart rhythms. The decision about which, if any, device is right for you depends on several factors, including how severe your symptoms are and how impaired your heart function or ejection fraction is. An ICD is an implantable cardioverter defibrillator and is intended to protect against fast heart rhythms that are potentially life-threatening. A CRT device stands for a cardiac resynchronization therapy, and it is a special type of pacemaker that makes your heart pump more efficiently. It may also be combined with a defibrillator. That device is referred to as CRT-D. ICDs vary depending on the number of leads or wires that are implanted into the heart. The simplest is a single chamber ICD, where there is just one wire sitting in the right ventricle. In some cases, a second lead or wire may be implanted into the right atrium. These are referred to as dual chamber ICDs. Indications for ICDs would be primary prophylaxis. And what that really means is sometimes the ICD is implanted before the patient develops symptoms related to a ventricular arrhythmia. There might be an impaired pump function, or that's that ejection fraction that you often hear about. Um, if the ejection fraction is less than, say, 30 to 35%, depending on how medicinal treatment has gone and symptoms are occurring, an ICD may be indicated. As well as if the patient is symptomatic, if there's been a history of fainting, passing out, maybe even cardiac arrest, that would be an indication for sure. Other reasons for an ICD might be preventing against sudden cardiac death from some genetic conditions like a hypertrophic cardiomyopathy. CRT, or cardiac resynchronization therapy, also called a biventricular pacemaker, is a specialized pacemaker that works by making the two pumping chambers of the heart, which are the right and the left ventricles, pump at the same time in order to improve the overall functioning of the heart. Indications for a CRT would be that poor ventricular synchrony, so that left and right ventricle aren't pumping at the same time. That's happening, and the patient is also symptomatic, has a reduced ejection fraction, and despite all optimal medical therapy, a CRT device may be indicated. LVAD, or left ventricular assist device, are specialized mechanical pumps that take over the pumping function of the left ventricle. They are often used as bridge to heart transplant, but sometimes can be used as destination therapy for advanced heart failure patients who are not suitable for heart transplantation. The implantation of a left ventricular assistive device is a major open heart surgery, and patients have to undergo extensive evaluation preoperatively. LVADs require a lot of energy to run, which is why they are powered by batteries that must be carried on the outside of the body at all times. Heart transplantation can be a life-saving therapy. It is an option for the sickest patients who continue to have symptoms of heart failure or require frequent admissions to hospital for heart failure, despite being on the best medical therapy and having the appropriate device therapies. If you're being considered for a transplant, your doctor will order a number of tests in order to determine whether you are a suitable candidate. Tests might include blood work, a cardiopulmonary test, echocardiogram, another heart cath. They'll look at your lung function, do ultrasounds of your arteries and different organs of your bodies. Also do some cancer screening to make sure you're an appropriate candidate to receive a heart. Once you are considered a candidate, you will be put on a heart transplant list. Your rank on the list is determined by your severity of your condition. For example, someone who is sick and admitted to hospital is given a higher priority than someone who is stable at home. After the heart transplant, a patient will be in hospital for several days, and the patient will need to take anti-rejection medications for the rest of their life. New heart failure management technology on the horizon is an implantable hemodynamic sensor. This device is a miniaturized wireless monitoring sensor that is implanted into the pulmonary artery during a minimally invasive procedure to directly measure the PA pressure. When the PA pressure is elevated, it can indicate some pending fluid retention. So it would indicate fluid retention before a weight would change or ankles would swell, those kinds of things. The system allows patients to transmit PA pressure data from their homes to their healthcare providers, allowing for personalized and proactive management to reduce the likelihood of hospitalization. The sensor is designed to last the lifetime of the patient. What is one thing you learned from this presentation? You may say, You learn the heart is a pump. In heart failure, the heart is unable to meet the blood or fuel demands of the body. You might say you learned that an ICD is intended to protect the individual against the dangers of fast or uncontrolled heart rhythms. You may have said that a CRT is a specialized type of pacemaker that helps your heart pump more efficiently, not too fast, not too slow, decreasing the workload on the heart and improving heart failure symptoms. For more information, speak to your exercise therapist. Visit the heart failure section on our regional site at www.gethearthealthy.ca/heart-failure. Schedule an appointment with our dietitian and speak to your doctor or heart failure nurse. Thank you.